chemicals. And when you were younger, did anyone ever tell you drinking coffee would stunt your growth?
Yeah, well, that's one of the common misconceptions about it that still exists despite years of research that actually says otherwise.
And KINT News 3's Dee Steepen, she's talking to Mayo Clinic experts this morning and getting to the bottom of the coffee debate once and for all. She joins us now live in Rochester with the story. Good morning, Dee.
Good morning, Tyler and Ariel. Dr. Donald Hensrud is the medical director here at the Mayo Clinic Healthy Living program. He says when talking to his patients about their diets, a lot of people think that they're drinking too much coffee and have concerns because they tell him they've heard it's bad for their health. That is a pretty persistent misconception that coffee is bad for your health, even though evidence from many different studies suggest exactly the opposite. Coffee has been associated with decreased mortality rates as well as decreased risks of developing type 2 diabetes, Parkinson's disease, liver disease, and various cancers. So I asked Dr. Hensrud why he thinks it still gets a bad rap.
Years ago, there was a study that came out that showed that coffee was related to pancreatic cancer. And I still hear about that study, even though it was in the 1980s. It was not a good study, but early data suggested that it might not be as healthy as we know it is now. So there's this persistent myth, and myths are hard to change over time.
Now, he says there are a few reasons people should decrease their coffee consumption. Anyone who suffers negative side effects from caffeine, or women who are pregnant or trying to become pregnant. He says in that case, limit it to 2 cups of Joe a day. Everyone else, feel free, though, to drink up. Live in Rochester, Dee Steepen, KIMT News 3.
All right, thank you very much, Dee. And a recent study of 500,000 people in the UK concluded that drinking coffee